I think yeah, perfect. Recorded have been launched and everyone is informed. So let's start and let's see if more colleagues that are registered will join as planned. So just to set the scene, and because we are a very small group, we can maybe do in a different way, shorter and straight to the point. But I think it's a very interesting opportunity to have Renzo with us, and also to tell him about the working group that we have launched since last year conference on health equity and climate justice as an space to think about how to transform those insights into action. And we are now, let's say, it's my opinion at least, blocking in the gap between theory and practice. And that's why those series of webinar to really try to understand how we can make a step forward. As said, so first of all, I introduce myself very quickly because we know each other. So my name is Davide Ziveri. I'm an environmental health specialist with background in social psychology, working at Handicap International NGO, and I'm co-chairing the Planetary Health Working Group of Because Health. And just an information for everyone, as said, the other speaker, Dr. Marallino from Ministry of Health in Italy, he cannot join in this moment, maybe later, we hope so, because there is a bomb alarm in the Ministry of Health in Italy, and so they evacuate all the staff. So probably nothing serious at the end of the day, we hope, but still disturbing, and yeah, difficult time for health staff everywhere. So we just hope that he can join us. Yeah, because we are very small group, I suggest that we can do it really as a dialogue to present our work and to have the rest of presentation. But maybe Magali, you want to say really 2 words about the Because Health first, please.
Okay, good morning, everyone. I'm Magali. I'm the coordinator of Because Health. And Because Health is the Belgian platform for global health. So we unite organizations, stakeholders from different backgrounds as NGOs, but also academic institutions, student organizations, consultancy offices. So all organizations in Belgium that are involved in global health. We have several working groups. One of them is the working group Planetary Health. It has emerged after our conference in November 21 on climate justice and health equity. We have been started afterwards and found, as Davide said, that it's not so easy to really see what is planetary health, what does it mean, what does it entail, what are the ideas and the values behind the topic. For our working group, we really value the inclusiveness of the topic. Also the justice and equity angle from planetary health is very important. We want to give a voice to those that are not often heard. And to elaborate the working group a bit more, we decided to organize several webinars so we can build our own knowledge on planetary health, see what is happening in the sector of planetary health all around the globe. We want to hear different voices. So it's really nice that you all here to join us, and I hope we will have a very fruitful discussion, and that this is not a single seminar that is ended after 1 hour or 1 hour and a half, and then it's finished. It's really a start of a relationship in between us. So I hope also with Renzo and the other speaker that might come, that we have a connection on this planetary health topics. As the working group of Because Health around planetary health, we also want to be the representation in Belgium of all organizations that are involved in climate, the climate activism, the climate emergency, and health issues. So there's nothing in Belgium yet new network uniting all these organizations. So as Because Health Working Group, we also want to take this role in Belgium. Voilà.
Thank
If
you.
there are any more questions, be my guest.
Thank you. So yeah, and just to add that what it will be said today, and that's why we record also the video, it's really inform our vision of planetary health, and it helps us to frame what planetary health could be for this group. So thanks for your input. I introduce Renzo. I guess that many of the audience know you because you're very active in advocacy at the global level, and it's so appreciated because we really need champions for planetary health approach. And so I don't spend too much word into presentation, but just to let anyone know that you're the co-founder of the Sunway Planetary Health Center in Malaysia and working also in Philippines. But you have also, we can say in this small group that you have also a link with Belgium because ITM. And so welcome back, let's say somehow. I let you the floor really to introduce your experience on planetary health and the main challenges that you can find, and then we can really open to the dialogue because I say we are a small group, so dialogue is absolutely easy to facilitate in this case. And at that moment we can also introduce each other when we take the micro. Please, Renzo, the floor is yours.
Hi, everybody. Thank you very much for this opportunity. And I'm really thrilled to be joining Because Health again, not for the first time. As you mentioned, Davide, thank you very much for arranging this. I was a former visiting fellow at the Institute of Tropical Medicine in Antwerp. And when I was there in November, or rather September to December 2019, that's like a month or so before the pandemic began, I had the privilege of attending your event, your conference in Brussels. So yeah, it's like a reunion. I'm not sure if I've met several of you in person, but surely it's great to be reconnected with the network. So let me just share with you my slides. And there's so many things happening here in Southeast Asia when it comes to planetary health. Especially over the past 2 to 3 years. Yes, we might have been in the middle of the pandemic, but it did not stop us from really developing the field, the community. And I had the privilege of building not just one, but 2 research centers focused on planetary health in this part of the world. But I chose to focus on one of them, which is the one in Malaysia, the Sunway Center for Planetary Health. It's based at Sunway University, one of the fastest rising universities in Southeast Asia, in Malaysia. And the university in general made a commitment to become a planetary health oriented university. So it's not just, the center that is focusing on planetary health. At the highest level, at the level of the top governance of the university, planetary health was embraced. And the goal is for planetary health to be embedded or incorporated into the many different units, schools, programs of the university, that every graduate of the Sunway University will be exposed to planetary health in the coming years. So let me just share with you some of these slides. And I'm not sure if you've already had a prior session that introduces to you the field of planetary health, how planetary health was born, what is its genesis. But very briefly, it emanates from this recognition that we are now living in an era where there's so much accelerated change that is happening in the environment, changes that are anthropogenic in nature, human-induced, because as a result of our human activities, fossil fuel burning, urbanization, technological advancement, continuous population growth, among others. And so all of these changes in society are leading to changes in the environment. As you can see in this series of diagrams, everything continues to climb up, and the question is, until when will we allow these trends to continue? And in terms of ending these trends, we know that one guideline or guidance that we may follow is the concept or the framework of the planetary boundaries, which was developed by the Stockholm Resilience Center in Sweden. As you can see here in this diagram, there are 9 planetary boundaries that have been identified, and unfortunately 5 out of 9 have already been violated or breached. The boundary for climate change, the boundary for biodiversity, because over the past century, we've seen the fastest rate of extinction of creatures great and small. The boundary for land system change. We've been turning every natural ecosystem into human habitation, city, a concrete jungle, so on and so forth. We have already disrupted the natural biogeochemical flows of phosphorus and nitrogen because we've been pumping our soil with fertilizers comprised of these elements. And then the final and the most recent boundary that we've already that we have violated is the boundary for novel entities, especially plastic. These novel entities pertain to chemicals, materials that we've manufactured inside the lab and that we've been releasing into the environment, whether to the soil, water, or air. So 5 out of 9 have already been violated. And we know that as we continue to damage our planet, the damages in turn will damage our health. I will not belabor you with the details of this diagram, but as you can see, what happens to Mother Earth, all these changes, all these human-induced changes will then lead to a wide range of health effects, such as the ones that you can see on the right. And what are these anthropogenic changes that we are not just anticipating for the future, but are already happening now? For sure, we're still very concerned about the ongoing pandemic. Will there be more surges to emerge in the future, in the near future? But we know that if climate change continues to worsen, the likelihood of another zoonotic spillover event, the likelihood of another pandemic emerging is very, very high, continues to rise. And unfortunately, our region, Southeast Asia, is really at the heart of this, future of potential pandemics, because Southeast Asia is home to some of the most biodiverse regions, ecosystems in the world, where a lot of these pathogens are residing, in animals, in wildlife. And when it comes to the impacts of climate and health, particularly through extreme weather events such as typhoons and flooding, but also intense heat, as you can see, our region is really at the heart of the crisis of the climate emergency. And in particular, as you can see in this map, the redder the country is, the more vulnerable the country is to the climate crisis. And unfortunately, the reddest of them all is my home country, the Philippines. So given all these challenges that we've just discussed, the anthropogenic changes to the environment, which then lead to a wide array of health impacts for our human populations, we need a new approach, we need a new paradigm, and we at the Sunway Center believe that that paradigm that we need for a better future is the paradigm of planetary health. As you can see here, it's the achievement of the highest attainable standard of health, well-being, and equity worldwide through judicious attention to political, economic, and social systems. In order to advance humanity's well-being, the declining state of planet Earth can no longer be ignored. Again, the health of people, the health of the planet are deeply intertwined, if not inseparable. So how are we approaching planetary health, the planetary health challenges that we discussed a while ago at the Sunway Center? So what we did is we identified priority themes because, we're a small center, although we're continuously growing, and there are so many challenges that need to be addressed, but we've identified the ones that are, salient and, prominent and relevant to our region. So one is preventing the next pandemic, making sure COVID-19 is the last of its kind. Second is tackling the climate emergency. As you've seen already a while ago, our region is very vulnerable to the climate crisis. Creating healthy cities, because cities are a good place to really address many of these planetary health challenges. So, Asia in particular is home to the majority of megacities. More than 50% of the megacities are in our region. So urbanization is indeed something that needs to be addressed in this part of the world. Achieving sustainable food systems. We want to make sure that we're able to feed people, but also in a nutritious and sustainable way, in a way that is not contributing to the climate crisis, but at the same time that is equitable, and not wasteful. And so this is also a key priority for our center. Another priority is advancing planetary health communications. We have observed, during this pandemic, that there's a lot of fake news and infodemics spreading around, not only when it comes to COVID-19 and the vaccination campaigns, but also for many of the planetary health challenges, including climate change. And so we want to make sure that if we are able to influence people, organizations, the public, media, to bend towards planetary health, we have to address the challenges faced with regards to communication. And as you can see at the bottom, all these should be underpinned by effective planetary health governance and a planetary health education revolution. So we need stronger, not just governments, but governance for planetary health. But we also need a citizenry that is oriented and aware and equipped towards and committed, to planetary health. So we are a one-year-old center, and what have we been doing? Our center is split into two main arms, what we call the knowledge and learning arm, which are, which cover the typical activities that you will be having in an academic institute, and the engagement and influence arm, because we believe that we can't just be working in the ivory tower. We need to make sure we're able to translate the knowledge that we generate into the real world. We are able to communicate that, disseminate to the worlds of policy and practice. And so, as you're seeing here a sampling of all our, articles published in academia, the research that we've been doing, but also the influence that we're already making in the policy arena with the Malaysian government. We were able to incorporate the phrase planetary health in the country's 12th Malaysia plan for 2021 to 2025. We were able to convince one ministry to start a planetary health framework. And we are also doing some activities at subnational levels, because we believe that, similar to what I said a while ago about cities, we believe that the arena of action is also the city, the town, the province. So I will not belabor you with the details of these slides because they might be appearing very small to you right now. But this just shows to you that we have already made some, achievements big and small when it comes to, governance, partnerships, but also academia. We've been engaging with, the different schools within the university, but also other institutions outside of Sunway. And we've also made sure that we are able to reach out to a wide array of audiences. As you can see there, we've had 100 public speaking events talking about planetary health across the region. We have a very active social media presence. And then we've had a lot of different activities with regards to youth engagement, for instance. Actually, I have some pictures in a bit. And then we have been advocating, and basically we're a very big fan of Kate Raworth's donut economics. you must be familiar that the city of Amsterdam near your country has already embraced the donut economy as their model for their post-coronavirus economy. And what we're doing now in Malaysia is we're trying to make one city, it's called Ipoh, to become Asia's first donut city, similar to Amsterdam. Because we believe that the donut economy, an economy that respects the planet's boundaries, while at the same time meets the social foundation of humanity, is the compass that we need for human prosperity. Okay? It brings together the SDGs and the planetary boundaries. And as you can see also, it resembles many of these symbols that we've been espousing and embracing in particular Asian culture, yin and yang, this idea that everything should be in harmony and balance. And I guess, and we believe that donut economy is the one that can bring us to that state of harmony and balance between people and planet. So these are some pictures of our activities in that city in Malaysia. And in fact, we were able to bring Kate Rayworth last month to Malaysia to be able to influence high-level policymakers and government leaders. I already mentioned a while ago that we have been very conscious and explicit and intentional in terms of bringing planetary health to broader audiences, to the media, to the WHO. As you can see there, I was speaking at the regional committee meeting in Manila, in newspapers and other public and communication platforms. Also, here at the Sunway Center, we've been always emphasizing that when we approach planetary health, we have to make sure we are doing it with respect to the cultures of Asia, and utilizing knowledge and wisdom from Asian cultures and traditions. So for instance, this is an example of a commentary that we wrote last year on the contributions of Islam to planetary health. And right now in Malaysia, there's a lot of discussion around how do we, raise awareness and educate people about planetary health, not in a purely Western approach, but also by incorporating knowledge and principles and values and wisdom from Islamic religion and tradition, among others. And then, as I mentioned a while ago, we've been very, we want to also ensure that our students in Sunway receive what we call a planetary health education revolution. And we have already introduced a course. It's called Community Service for Planetary Health. And the goal is by 2024, it becomes mandatory for all university students, regardless of their discipline or profession. They can be an accountancy student, or a culinary student, or a nursing student, or an engineering student, or a computer science student, but they will all be taking a 7-week course on planetary health with a very strong experiential learning aspect. And I already mentioned a while ago that we've been interacting with a lot with young people as well. We've been holding town halls and boot camps and hackathons, because this is another way to influence society and to make sure that we generate a new generation of planetary health citizens by engaging with the young people while they're young. So to find out more about the Sunway Center, I invite you to also take a look at our commentary published in April, where we introduced the center, our initial efforts, and our aspirations for the future. So that's it. That's the Sunway Center for Planetary Health. That is what we've been doing so far here in Malaysia and Southeast Asia. And I hope that this provides you more insights on how to grow your planetary health community in Belgium and beyond. Thank you very much.
Thank you very much. Thank you very much for presenting the center and the amazing activities that you and your teams are carrying at different levels. Actually, you mentioned many different points, and I'm sure that some colleagues that are part of the Planetary Health Working Group we're going to react, for example, on education that you mentioned, that of course is a core component. But I want to break the ice with a compelling question that I have, also considering that myself working in NGOs, our colleague Edward Hilo from HI Philippines, and Chris Xavieri from MBM, and other colleagues, because this platform, this group is also this future of sitting at the same table, researcher, NGOs, health practitioners. So it's one of the really interesting point of this group. And I want to mention it because, and actually you did also, there is this challenge of transforming this vision, this approach that we absolutely agree on, into action. So in terms of, I have the feeling that in terms of policies and research and education, the things to do are a lot, but are quite clear. When we come to operationalize all that, because there are, as you said, especially in other region and in other countries, the urgent needs, real needs, and as NGOs, as international NGOs, we witness those needs every day. So we really feel the urgency to transform into operation. But then it's difficult. There are many barriers in terms of mandate, sometimes in terms of expertise, in terms of funds, because we often work by sectors, and it's difficult to transform the multidisciplinarity or transdisciplinarity vision of planetary health into integrated programs. So I really just want to know more about those challenges, and I also invite other colleagues, especially from NGOs, and not only to have their say if it's something that they are also feeling and facing. Thank you. Sometimes we have no words facing to those challenges because they're too huge. But yeah, really from the group or from yours, which kind of barrier? I mean, the barriers are quite clear, but how we can overcome that to have integrated program.
Yeah, well, we're still waiting for our colleagues to jump in. And you know, you're basically asking a very multifaceted question. So let me just answer even just a facet of it. I think in terms of, and then, you know, this is still a work in progress. You know, we're not even close to success or full success when it comes to influencing policy change. We've just started experimenting the donut economy in one city, and everybody's now very excited, from the top leaders all the way to the bureaucrats, right? So that's good, right? We were able to already generate some awareness and excitement. On the other hand, at the national level, at the level of the ministry, we were able to incorporate some planetary health language into the national policy, right? So and there's also an interest to develop specific frameworks or policy frameworks to inform the ministry's future actions. So again, that's good news. We're not yet at the destination, but there's already intent and there's already a process that has been begun. So that's I guess one, I'm trying to, you know, make a reality check to, you know, for all of us, you know, that it may have sounded like it's a success and it's, you know, perfect, but it's still a work in progress, and maybe there are other, you know, planetary health groups across the world that are also experiencing the same, both initial successes but also challenges. But when it comes to, maybe you're wondering, okay, how we were able to make it, to do it. I think some of the key critical ingredients, one, you really need champions. You already alluded to that, David, a while ago when you introduced me, right? And at least for the Sunway Center, we have, you know, our executive director, who is a prominent, you know, Malaysian leader, very well respected, and she has the ears of top government officials in the country. So if we are able, if we are going to replicate this experience in other countries, we need to find those kinds of people who are champions, who are so convinced about the planetary health message, who have access to people in power, uh, and who has a good track record. So that's one example, right, of an ingredient. We have to find more champions. And then, I think the other is we were given a very enabling environment in Sunway University. If you visit us, we were given some good amount of space, and an initial investment to be able to hire a good number of personnel in order to be able to deliver even during our first year. Because sometimes, if you have only 1, 2, 3 people working, and it continues to drag, the momentum loses, and then you're already in year 3 and year 4, and nothing has really happened substantially. So the initial phase is so important. How do you accelerate the action and the excitement, and have some initial success, because that initial success will also inspire not just our team, but also our mother institution to continue, right, to keep on providing that kind of support, and they are becoming more and more convinced by each day that they are making the right investment in planetary health. So maybe those are just some of our secrets. Well, not anymore secrets.
Thank you. Thank you for sharing those secrets and for framing planetary health as an innovation. So, and the challenges that are related to any innovation, of course. Yeah, I see, Edward, you raised it. Then the floor is yours, please.
Hi, David. Thank you. Can you hear me?
Yeah, perfectly. Go ahead.
Okay. Thank you for sharing, and Dr. Renzo. Thank you for. I think that's a excellent presentation. I'm Edward from the Philippines. So hello. So I'm just thinking right now with your all of the presentation, which is I'm very much aware. I've been in the development organization for quite so long, specifically in the sector on persons with disability and development and humanitarian. I'm just wondering how I know it's a first and innovative and just kickstart for just 1 year. I'm just wondering how this planetary health could also be added value at the primary health care, because as you know, in the some of the community uh, at the at the at the community level, one of the frontliner are really the health system there to improve the health outcomes, right? And definitely some of the primary health care, specifically one of their battle cries, really to resource so lack of resources, number one, and of course uh, the lack of education. So I think I'm really eager to know maybe in the future, not now, because I think the planetary health right now is not very new, but I think the innovation is quite really excellent. But I'm still looking at how the primary health care or those who are rural far flung villages could also benefit in the planetary health. No? And secondly, I'm also eager in how can we destroying out this, how can because you mentioned about the culture, so you successfully definitely integrating the culture in within the planetary health. I'm also looking at how people with disability could also participate in planetary health. As you know, they are also experiencing a lot of barriers, no? And definitely their voices and participation are very important because they are also experiencing a lot of health barriers and accessibility, access to health services, etc. And I'd like to also to think how can these people can be also integrated in the advocacy and in the planetary health, specifically an advocacy on the policy level, education level, and so on and so forth. Thank you, Davide and Dr. Renzo.
Thank you very much, Edward, my fellow Filipino. Very good questions. First, regarding primary care or primary health care, interestingly, I co-authored at least 2 articles saying that primary health care in the 21st century should now include planetary health care. Okay. And you know, there are many dimensions to that. You know, for example, making sure that the environmental footprint of primary care is minimized, right? That's one. But of course, on the other hand, you go to other places where there's no primary care to begin with, right? To decarbonize. And so how can we actually use, let's say, issues around energy and environmental destruction as a platform for pushing for more primary care in these you know, far-flung locations, for instance, because unfortunately you go to the rural countryside, those who are victimized by environmental problems are also the ones who do not have access to healthcare. So how can we find win-win solutions that address both the environmental piece, but at the same time provide the primary care that unfortunately is still missing for many people around the world? So those are just some of the ideas. You know, basically what I'm trying to say is there's no disconnect between primary care or primary health care and planetary health. In fact, there's so many potential synergies, and that space is ripe for innovation. Okay. On the other hand, the question around people with disabilities, over the past several years, there have been a lot of papers, well, not a lot, but there have been some papers, commentaries, reports being written about how people with disabilities are also going to be the ones to be negatively affected by, you know, calamities related to the climate crisis. You know, when there's a typhoon, you know, the people who are who do not suffer from such disabilities are able to escape you know, the negative consequences, and the ones that are bearing the brunt are those who are living with disabilities, who also do not have the financial and other kinds of resources to address the aftermath. So if you're working in the space that is serving our, you know, brothers and sisters living with disabilities, this is the time to also start thinking, how can we incorporate these planetary health, climate change elements into our work? Again, it's you know, there's certainly a lot of potential convergence. We just have to make sure they are being you know, surfaced and manifested. So yeah, thank you very much. I think we have 2 more hands raised.
Yeah, exactly. Thank you for raising those points, Edward, and Renzo for your clarification. Christopher, I think you're first. Please go ahead.
Okay, thank you. Thank you for this very comprehensive and informative presentation. Particularly, I think the comprehensiveness of your problem analysis is very impressive. But there was one dimension I think that could have been highlighted a bit more. And that's the relationship between planetary environmental health and social inequalities. If you look at the global, at the carbon footprint of the wealthiest and the richest, it's as unequally distributed as wealth. So before we question ourselves on the carbon footprint of primary healthcare, we should also be explicit about the carbon footprint of the milliardaires which fly to space. I think we can deliver a lot of vaccines and have a lot of refrigerators. Will have a smaller carbon footprint as when milliardaires go to space, or the footprint they leave behind. So I think the relationship between economic inequalities and planetary health should also be made very explicit, and inequalities have as equally grown as many other graphs you have shown on your first slide. That's a small comment, but otherwise, congratulations for your presentation.
Thank you, Christopher. Well, I have limited time, so I had to delete my several slides on equity. But if you remember the definition of planetary health, I highlighted there the term equity. So it's certainly a part of the planetary health story. And you're correct. I think we need to keep on highlighting that the planetary health damage, while happening on a planetary scale, or affecting us all, universally, is all, these damages are also being unequally or unevenly distributed across populations, whether within or between countries, within or between regions, within and between socioeconomic classes as well. There's actually a classic map, and that's one of the slides that I remove. There's a classic map from the WHO showing that the countries that are emitting the most are totally different from the countries that will be bearing the brunt of the health consequences of climate change. And so certainly, equity and justice, even, that's another term that perhaps we should be emphasizing more and more, because planetary health is not just about justice within our generation, it's also about intergenerational justice. In a way, we could say that we've already stolen the ability to live and thrive from future generations who are yet to be born, by destroying this planet and making it less and less inhabitable.
Thank you, Renzo. Before giving the floor to Ridi and Azad for more question or comment, just to inform you all that the other speaker is so sorry, but he just confirmed me by phone with a message that they are still out of the office, evacuated because the threat at the Ministry of Health. So it's really so sorry, but he cannot join us. And so, Renzo, thanks a lot, and sorry for putting you on the spot the whole time. It was planned in another way, but we take advantage of your presence because there are so many questions that we want to share. So thanks for this extra effort. Ridi, the floor is yours.
Thank you, Renzo. I just wanted to say that, I'm also part of the working group here, and I'm from India. I was doing MPH there. So that's how I got interested in planetary health. So I'm pretty new in this, but then what I'm finding out, like working on the planetary health education, how it is working. And I find there's like a lot of segregation. People are not able to understand what is planetary health yet. And even for climate change or environmental change or public health, they are like working in separate entities. So for planetary health, we need to bring all people together. So how do you think that could be your example of the Sunway University is like really good, because it's encompassing all fields and, a sustainability and course for everyone, no matter what field they are. But then to bring that kind of thing for overall, be it in India as a whole, or nationally or internationally in global levels, how do you see that coming together? Any suggestions for that, or how do we look into it, or any strategies you have looked into it?
Yeah, well, that's why, if you remember, we highlighted planetary health communication as one of our priority themes, because you're correct. It's still a challenge. I mean, we will not probably be having this conversation if everybody already understands what planetary health is. But in some way, we are doing our part, right? We are trying to dispel, misconceptions and clarify and communicate. I guess one of the other secret ingredients that we've had is, the power of storytelling. We're not talking about planetary health with full of jargons and from a purely academic and technical approach. In fact, we mentioned 100 speaking engagements, majority of that not to fellow academics, but to broader audiences. And of course, because the audience is broad, we are always challenged to simplify our language, to make sure our story touches not just their brains, but hearts, making the examples and the issues that we elevate really relevant and resonant to their realities. So I think those are some of the strategies if we are to be successful in communicating planetary health to a wide array of audiences. And also, again, because this is new, people always complain like, how can we communicate planetary health is too complicated, but it's actually an arena for creativity and innovation, right? No one taught planetary health to me, but I understood the message and I turned it into my own story. That is something that I've been communicating to people here and around the world.
Okay. Sorry, one more question. When Christopher was also asking about inequalities, I had the same question, but how do we see it as a responsibility? How can we spread it as a message, as a responsibility? It's a responsibility of everyone who, especially from the rich class or developed countries, how we can spread this planetary health as a responsibility message throughout, because the word responsibility brings out some more essential elements rather than just being understanding that planetary health. What do you think about that?
Yeah, well, at the core of planetary health is this recognition that we are the ones creating the mess, right? I've highlighted several times the term anthropogenic, human-induced. It's not a natural phenomenon. It didn't come out of the blue. We created these problems ourselves. And these challenges are now getting back to us in the form of human disease, despair, if not death. So the responsibility element is central to planetary health. We can't be talking about planetary health and then do not identify who should be, not just blamed, but who should be held to account, right? All of us are to be held to account, but also there are specific institutions that need to be held to account, that should be responsible. And I guess to be effective in our emphasis on their responsibility is to also be clear with what are our demands, to them, right? Because we can't keep on blaming and naming and shaming and pointing fingers, which we do a lot, right? But if we don't have concrete asks, what should they be doing, right? And perhaps some analysis of what needs to be compromised, if not sacrificed, then will not be very successful in our communicating of the responsibility that needs to be fulfilled or honored.
Thank you. I see the time going very fast, and so I see Azad raise hands and Magali, and I suggest to make this last round of with two questions. So please, Azad.
Yeah, thank you, Renjo. Hope you're fine. Yeah, so actually my question is you are doing tremendous work from Sunway in Philippines, but recently we worked on capacity building or plant health education among health professionals. And then we realized that there is a big gap between global south and north. That is the decolonization you are talking about, and me also. In that case, is from your education institute like Sunway Planetary Health Center, are you working anything on the curriculum development in the undergraduate medical or allied health professionals in Philippines? Because I think that it should be started in the global south or Southeast Asia.
Yep.
Okay.
As already, thank you, Muhammad. As already mentioned a while ago, we actually developed a 7-week experiential course on planetary health and community service that is going to be required to all students regardless of discipline. It's not just for medical students. It's not just for health professional students. And in fact, the challenge that we're now trying to address is that this course, because it's experiential, it has to be taught by teachers, and I can't be teaching 3,000 students by 2024. So we are training all teachers from all disciplines on Planetary Health 101, and so that they know how to tutor and how to guide their own students. So that's another approach. We're not just teaching the students, we're teaching the teachers on how to teach planetary health, even at the very basic level. I mean, we always say planetary health is transdisciplinary. So the teaching of planetary health should also span all sectors and disciplines. Otherwise, if it will only be taught by doctors like me, then we are, defeating the very spirit, the very transdisciplinary spirit of this new field.
Yeah,
so
but
that's
yeah, but definitely the medical curriculum is a little bit challenging due to the following of British curriculum in global, like in India and the other colonial parts. So definitely it will be a big challenge. That's why I mentioned about the medical curriculum specifically. That is, I think that will be a tough job.
Yep. And I think the way to do it is just do it and share with me what you've done. Because right now that's not what I'm working on. But for example, our Department of Nursing already expressed interest in developing a module on planetary health and nursing, right? And if you Google for a planetary health nursing module, you'll not find any. So I think the only way to go is for us to innovate and create, because those models do not exist yet. And if we're able to create those models, especially in the global south, then that will contribute further to the decolonization of health education. I think Magali also has a question.
Yes, thank you so much, Renzo, for this very interesting presentation. I had one short question. It has come up several times, but I'm still looking a bit for the difference. If you have the definition of planetary health for you, what is the main difference with like climate and health or environmental health? How would you frame it that what is the real difference between the work that has been done on climate emergency, on environment, and the new paradigm, as you call it, for planetary health? Very shortly, just, and then the second question is more a question to you. We have been asked with our working group here in Belgium to contribute to a conference which is named Educate. And the theme of the conference is about education and climate. They started from the idea, how does climate influence education on all levels, from primary to university level, and how does education influence climate? So it's a quite interesting conference topic. And we wanted to talk about planetary health education because we want to show that it's not only climate effect in education and education affecting climate, but that's something more holistic. So my question to you was, if you were willing maybe to help us, assist us in developing our workshop at this conference, that would be great, because you have so many experience from practice. I think we would be very happy if you could join us. So these were my two final questions to you. I thank you so much for being present.
Thank you so much. Well, for the second point, we can discuss offline. Admittedly, I'm like You know, I'm at my 1000% capacity. But when it comes to the first one, I mean, that's always a question, like how does planetary health differ from these other terms, right? And there have been papers written about this. Some perhaps are too much over intellectualizing, in my opinion. On one hand, as you may already have noticed, I have been strongly advocating for planetary health, because I think for me, it's the most encompassing of all the healths compared to, for example, One Health or EcoHealth. And you know, these different healths have their different, I guess, disciplinary origins, right? One Health really came from, you know, the veterinarians' recognition that that the health of animals are interlinked with the health of humans, et cetera, et cetera. Planetary Health came from this, and this is where my bias as a health professional comes in, right? It comes from this recognition that, oh, I can't be treating anymore just people, because there's a planet that's also sick, you know, that needs to be taken care of if I want to advance the health of my human patients. So that's how I simplify it, right? I don't need to give a very technical definition of planetary health, which academics like, but which the public and policymakers do not even understand. And then on the other hand, you know, while I said that, you know, I advocate for planetary health, on the other hand, and I say this only very select few, including yourselves, honestly, is healthy people, healthy planet, healthy animals. You know, maybe we should just be describing our goal rather than be stuck in these academic terms. Okay, if you think that the academic terms are more of a hindrance rather than an enabler. But in our context, you know, in at least for Sunway, planetary health has been more of an enabler rather than a hindrance. But I already shared with you some of our secrets. Effective communication is key, because if you're not able to articulate what it is in a very simple way, then it's very difficult to you know, rally people around it, right? And to convince them that planetary health is something that everybody can share and embrace. Yeah, so those are some of my thoughts. For sure, not very, I guess, decisive. And admittedly, it's still, you know, a thought process in me, you know, that this idea that, okay, by the way, I'm part of the Lancet One Health Commission, if that confuses more, right? So, but it shows that I am comfortable in all these different spaces. It's not like I'm so obsessed with planetary health and so rigid about it, and I am not going to deal with people who embrace One Health. In fact, it's all about finding the interconnections rather than dwelling on the perhaps very minor differences. Yeah, climate and health for sure is very narrow, right? Because it's really just about climate change and health, right? When planetary health, we're talking about the overhaul of the economy that is needed, the wide range of environmental changes that are human induced that need to be addressed, which and climate change happens to be just one of the many.
Thank you very much. And as you said, behind labels, I think that the vision is very clear. The challenge is to operationalize such a vision too, but it's part of the process. So thanks a lot for having contributed to this storytelling that we are together building, co-building in different parts of the world and in different spaces and in different organizations. So it's really, I think that it's really important to have those kind of meetings to add more elements to this storytelling and also to make one step more, step by step in this process. We are just at the beginning, as you said, so yeah, sometimes we can feel a bit lost. I speak for myself at least, or a bit disoriented or even discouraged because it's something new, but we don't know exactly how. But I think that there is also a reasonable hope there and the motivation to innovate, to test, to pilot, to act, and then of course to learn also by doing. So there is this huge effort at research level, and we maybe need also to integrate efforts at the field level to learn by doing with the communities, because of course a lot of expertise is already there with the communities. And actually, just a small advice, a small advertise, because I just launched save the date for the 7th of October. We'll have another webinar inviting an indigenous leader from Colombia to have also a different epistemology and way of looking at those relationship between environment, health, human health, animal health, etc. So thanks a lot. Thanks, Renzo, and thanks to all participants and colleagues from the working group. And yeah, so I'm sure that we have more opportunities to meet, maybe at the Educate conference or at the Planetary Health Alliance conference very soon. So thanks a lot, and see you soon. Thanks, everyone.
Good night.
Bye. Good night. Good afternoon.
Bye. Thank you.
Hi, Mahali. Should we talk over the phone or the Zoom?
Your connection is okay?
Yeah. It's
okay. We can we stick around a bit in the Zoom.
Yeah, okay. All right, that would be good. 1 second.
So you had a question about David is asking debriefing. I will tell him that we're still
Okay, if you want to, we can join in. I mean, I can talk to you over WhatsApp again later.
yeah, but you have some second thoughts or what? You're on mute.
No. So just because, I mean, I couldn't talk to Jaker, and I was like wondering like what we will be doing.
Ja. Ja, ik heb een berichtje gestuurd. Ik zit op 12:30 ongeveer vast. Ja, wacht, maar kijk, ik zal anders zien of dat ik wat vroeger kan komen. Maar ik kan gestuurd of dat je niet meer alleen mee komt. Oké, maar kijk, ik doe mijn best. Binnen 10 minuutjes kan ik wel vertrekken, denk ik. Ja. Oké. It's such a hectic day today. Okay. Yes.
We can just, so I just wanted to like, I just spoke to Jaker now because I couldn't reach him before.
Mm-hmm.
And that's a relief now that he's back. He had some medical issues. So he said we will figure out something for the educate, but I don't think so we'll have enough time, but would do a little bit of a literature review and then have kind of, because we haven't started anything on scoping review yet, because after the meeting he got sick, and then
but I think because at the educate meeting nobody will know what is planetary health. So
okay.
anyways, we have to start our workshop. I think it's on.
And the second day.
I have to stop recording.
Oh, yeah.
It depends on what you're saying. I don't know. I'm joking.